Hey everyone, Spot of Nerd here with another series, series 2 of New Dimensions. Today I wanted to talk about something a little bit on the aggravating side of things, the anger, the boiling, ready to pop, mainly in terms of having to fight for your own healthcare. Before we talked about, the basics of having just chronic illnesses and mental disabilities, things like that, just from a depression standpoint, etc. But let me kind of give you, based off of my personal experience recently. Again, for those that might not know, I've recently started some treatments on my lower back to try and help the pain. I'm in pain 24/7. The pain can get upwards of 10 out of 10. It's agony, it's torture, which of course means medications, etc., so on and so forth. So recently I had a little glimmer of hope. I went to a specialist and they positioned, we could try doing an injection for steroids to alleviate the pain, and then of course we could potentially move on to maybe a surgery. We actually had everything laid out. Come today, that whole game, that whole plan is being thrown completely out the window. And let me tell you why it's so incredibly frustrating, because probably maybe like many of you know, if you go through this chronic pain or chronic mental illness, whatever it might be, or maybe you've known somebody, you have to fight for your healthcare. You have to fight for your own treatment. That to me is disgusting. It's horrible. Since when do we have to fight for our own healthcare? Like, we know what's going on with us. We know what's wrong. We have the symptoms. We've been dealing with it. And we get these professionals. And I'm not saying everybody. Please don't quote me. I'm not saying every medical professional. I've had many that actually have helped and supported me. But then you just get those few that, frankly, I don't know how they get their degrees. I don't know how they get to where they're at, because you gave me a plan of, we need to do step number 1, then we're going to move on to step number 2, and then we're going to have your surgery. So we did step number 1. I go in for a follow-up today. We're not going to do anything else. So I literally almost had an argument with the medical professional in the actual room, in the checkout room area. And it boggles my mind, is because I'm literally giving them facts about, you've seen my medical records, you've seen my treatments, and now you're going to just basically flip it 180 degrees. Why? Long story short, fight for your healthcare. If you're not getting the treatment you think you deserve, fight for it. Continue to fight however you need to fight to make sure that you're getting that proper care. And if somebody is telling you one thing and then the next day they're telling you a completely different thing, that is the wrong doctor for you. I can speak so many examples to that. Obviously, most recently with this whole idea around the surgery. It's not to say that I'm not doing what they're telling me. It's not to say that I'm trying to get away or trying to manipulate or whatever you want to call it. I'm literally doing exactly what they're telling me, and then they change the game. And that is what is so infuriating, and it is so frustrating about these medical professionals, is because, number 1, and I'll give you again a little more detail, I had a steroid injection. We have done those before in the past to no relief. They did not help whatsoever. But according to this doctor, we needed to step 1, do a steroid injection, knowing that it wasn't going to work, knowing that it hasn't helped in the past, knowing that, frankly, if this is what we got to do, then I'll fucking do it. I don't really care. So what it came down to is, you can look at my medical records. I have decades worth of medical records stating these don't work, but if this is what we have to do to get started towards a road to surgery, then I'll do it. Another thing that also really bugs me about it is, I'm paying for these procedures. The insurance companies are paying for the procedures. So why am I paying for something that, number 1, is not going to work, and number 2, if you know it's not going to work, why are we still doing it? Because why can't we move on to step number 3, which inevitably would be a surgery? You literally, not so much as a couple weeks ago, told me that this surgery would probably alleviate the pain, or at least a lot of the pain I go through. So why are we changing our mind right now? I apologize that if this sounds a little bit on the negative side or a venting side or whatever it is, but again, I'm hoping that with these specific Spot of Nerd episodes that you're kind of getting a little bit more understanding, maybe from yourself. Like maybe you are feeling in that same way that I am right now, where it's like you're being told one thing and then the next moment it's something completely 180-degree change, not for the better. Wrapping everything up, it's one of those things now. I will once again have to start from scratch. I will have to go out, I will have to find a different doctor, specifically neuro, and I will now have to start all over again. I will have to pay the exam fees, I will have to pay the consultation fees, I'll have to pay whatever procedures they might want me to do. It is just so frustrating. It is so agonizing because I mean, it's pretty self-explanatory why it's frustrating and everything in between. I don't want to be like this. I don't want to be in pain. I don't want to have the mental depression. I don't want to have chronic pain my whole life. And a little bit of a side piece to my favorite, and I'm being totally sarcastic here. I was told today, well, you need to exercise and you need to do this and physical therapy and things like that. If you look at my records, literally in the last 10 years alone, we have tried PT nearly half a dozen times. Every single time has resulted in me going on pain medications 3 times what I'm taking right now. I mean, seriously, how are you in your medical field when you're literally reading what I've done before? These are official medical records that have stated PT will make things worse. Wouldn't you want to try to find the underlying issue? But now, today it's all hands off. You know, you're going to have to go chat with your other specialists to figure out what's going on because too many other things are going on. It's complete and absolute bullshit. Venting done. Apologize. But fight. Fight for what you know. If you know something is wrong, fight to get the care you need. Fight to get the care that you deserve. You don't have to go through this. We are in the year 2020, nearly 2021. The medical advances that I've done, my own research that medical professionals have taught me about. I'm not sorry, not sorry as they call it. I call bullshit on the fact that this is just something I'm gonna have to put up with. False. Bullshit. And that is why I keep fighting. That is why I keep pushing through. That is why I keep cursing. That is why, sadly, sometimes I have to push people away. It's not anything personal or anything, I mean, it is negative, but hopefully you get where I'm coming from. There are ways we can sort this out, but I don't understand why the plans have to keep changing. We set a plan and we move and we go ahead and we take that plan into action. And then somebody comes along, one person, and says, nope, gonna cut it. We're done. Fuck. I'll leave you with a little bit of inspiration. Fight the good fight for your medical care. Fight the good fight to receive the treatment that you need to be better, to make yourself feel better, to make yourself happier, to make yourself just not be in pain. And if you need my help, please reach out. I would love to hear your story. I want to hear your story. I want to hear your comments. What have you gone through? What have you had to deal with from the medical professionals? Because it's funny, I'm sure there's many people out there that have actually legitimately done their own research. I'm not saying we're doctors, I'm not saying we're specialists, medical professionals, but it's amazing the knowledge that we have, the people that go through this every single day. It's funny because today was that day as well when I did this follow-up visit. When you start throwing it back in their faces, the medical, the terminology, the articles, the research, all this, it's funny how they can't back up their own claim. Funny how that works, huh? With that in mind, thank you all so much for watching. Please hit me up in the comments or send me a message. I'd love to know your story. You're hearing me vent, go ahead and vent out to me. I'd love to listen because maybe we can share a story or two or maybe some tips and tricks. But also, please don't forget to hit that subscribe button down below. Much appreciated from yours truly, Spot of Nerd. And we will see you guys next time. Later, y'all. You know one little tidbit after credit scene here about kind of this whole situation with the medical professionals and changing their minds and yada yada yada. We should get refunded because even though I do have health insurance and of course I pay all my bills, why shouldn't I get refunded? I'm literally like, I hope I get a feedback survey. You know, you always get feedback surveys from your visits, your office visits, I'm not going to be disrespectful, but I'm going to make sure they're fully aware and I'm going to lay it out almost in an essay to make sure that they're aware of what they're doing, because literally what I had to go through today with this follow-up visit from my injection could have been an email. I didn't have to pay this office visit. I didn't have to drive out to the hospital, risk myself, especially with everything going on right now with COVID. Anytime I do these treatments, these follow-ups, I have to go to ground zero. I have to go to a hospital. I have to get tested. And I went today and it's like, you're telling me nothing's gonna happen now. Why couldn't this been a phone call or an email? Something to think about, right? Almost as if they just want the money. Crazy, no?